First is from Dr. Elspeth Mathie, who's a reader in health and social care inclusion at the University of Hertfordshire, and she co-leads the inclusive involvement in research for practice-led and social care theme within ARC. And Elspeth is going to talk to us today about ARC and its role in developing food with care strategy for the region. Elspeth.
Thank you so much for that introduction, and very wordy. And I've just been so fascinated by all the talks today and how different, but so many similar themes. So I'm not a clinician. My background is I'm a researcher. As you correctly said, I'm based with Wendy Wills at the University of Hertfordshire. And to sum it up really is trying to enable lived experience voices into research and practice. So that's really what I'm about. I was very interested to hear about the dementia, because I carry out a lot of work with dementia as well as young people, about designing buildings, the tables, the co-production. So the next slide, please, if we can. So the title of my talk today is Principles of Co-production and How to Achieve This in the Delivery of Food with Care Vision. So in the world of involvement for researchers, there is so much terminology, and I want to keep what is different about involving children. So when we talk about public involvement in research or design of services, it's about carried out with or by members of the public rather than to, about, or for them. So this is working with people, and one of the studies I was involved in, Rapport, we talked to clinicians and they would say, oh, I do patient involvement, I speak to patients all the time. However, involvement, as I'm sure most of you in the audience will know, is very different. It's about actively involving people in shaping the hospital services, the environment, as we've heard, service users involved in design, and actively involving people in decisions, the environment, the priorities. So I've just put some of the acronyms up there, and I will try not to use any of the acronyms today, but PPI stands for patient and public involvement, not payment protection or proton pump inhibitor, as I have recently been muddled up with. And PSIP is another term that people are now using, public community engagement, involvement and participation. It doesn't really matter, I think, what terminology we use. Some people like to call them service users in mental health. Other people are children. And as somebody we talked to yesterday was saying, we're all human, but whatever label we've got on that. But thinking what's different about involving children is, of course, the parents and carers or youth workers or community workers who are involved with the children are involved on the other level as well. So the dominant model for involving young people, the YPAGs, the Young Persons Advisory Group, is the dominant model, but not the only model. And we have these terms again of engagement, involvement, and participation. So next slide, please. So why do we involve those with lived experience? As the annual report of the Chief Medical Officer 2013, there's an expectation that patient and public involvement participation has no age limit. Children and young people should be encouraged and facilitated to participate in decisions about their own care and more broadly about the health and social care services and policies that affect them. So in the United Kingdom, it's a commitment to PPI in healthcare is now enshrined in key legislation. Any research that we put in for has to have some patient and public involvement. And of course, it's United Nations Convention on the Rights of the Child in 1989 established international recognition that all children have the right to have a say in the decisions that affect them. Secondly, it's public money. I can imagine in Cambridge, a lot of people will want to see that money, and around in the east of England, will want to see that money spent wisely on services that suit them. Thirdly, involving young people and children should lead to more appropriate services, more relevant services, more user-friendly, and improve the services for those who use the hospital and make it more inclusive to all groups, also out in the community, which is something, again, I see a thread through, not just the hospital, but out into the wider community. Now, I can see from what was being presented already this morning and the website, the newsletters, the film this morning, that lots of involvement has already been happening with children and young people in the design. And I like to see the entertainers coming in, the open spaces, and on that wish list, I saw that somebody was wanting a unicorn as well. So I'm probably, as is usually the case, speaking to a converted audience here. And then, however, there will be many who don't see why children and young people should be involved. There will be times when it's easier, quicker to take a decision yourself. So please keep persuading those who are not in our virtual room today the importance of building these partnerships with young people, not just once, but throughout. Involvement does take time, but keep it on the agenda literally. If we were face to face today, we'd have had some really fascinating discussions, I'm sure, over lunch and coffee and share experiences. And during my last sort of 10 minutes, because I've just got a small slot here, I'd love to hear your examples, experience of involvement and co-production with children and young people. And I'd encourage you to paste any links or reports you've got in the chat, and perhaps we can collate these to take forward as well. So on to the next slide, please. So patient and public involvement, consultation, collaboration, and co-production. And again, I just want to outline some of the background to this. Many will be familiar with Sherry Einstein's 1969 ladder of citizen participation, where the top rung was citizen control. This was adapted by Hart in 1992, and the bottom rungs are about non-participation, and the top where children and adults are sharing decisions. These ladders have been criticized as not a simple linear approach, and children, like adults, may want to be consulted at one point, then be more involved another, so sometimes consultation, sometimes collaboration, and other times co-production. And on the right here, we've got a diagram from Cormac Russell that Wendy and I and a number of University of Hertfordshire colleagues are working with on an asset-based community development approach. And here you've got about doing to, doing for, doing with, and finally led by the young people and children and family carers as well themselves. So next slide, please. So on to co-production. It's not a new concept. It's been around for about 50 years. But to be honest, I think in research at the moment, you would think it was new. This co-production is named everywhere. Everything's being co-produced. And I'd really like people to think very carefully what co-production means, because I think there's a lot of faux co-production out there. There are many definitions, and this is just one that I'm putting up here. And it is always suggested that in any agreed definition, when you're working together, everybody has an understanding of what co-production definition you're working towards. The Going the Extra Mile report by the NIHR in 2015 was a way of setting out clear objectives for leadership in public involvement, getting the public involved. And the recommendation was to move away from this tokenism to co-production. So co-production was really something people wanted to, want to aim for, not just having somebody on a steering committee, not just talking to a person at the beginning when you're putting in your funding for research, but really having people working with you, young people going throughout. And Involve has led to establishing the principles of co-production and research, published in 2018. And here they are, about sharing of power, including all perspectives and skills, respecting and valuing the knowledge of all those working together on the research, reciprocity, which I always have difficulty saying, reciprocal relationships, and building and maintaining relationships. And I think co-production really is about those building relationships longer term, and about, which I'm glad somebody mentioned before, about that feedback loop, having people involved. To do co-production well, organizations really need to make changes to their culture, structure, and practice, and regularly review progress. And we in the National Institute of Health, the ARC, East of England, we're really trying to get public involvement involved at all levels of our governance structure, having people on the board and having people have a say. It's difficult and it's not always easy, but we are moving towards that level. Next slide, please. So we all know about the theory of co-production, but how to turn this rhetoric into reality. It's about sharing power, but how is it done? And it's useful to have some examples and to highlight a few of our colleagues who I know and working in the East of England through our ARC. Dr. Luca May Brady joined us at Hertfordshire University recently and has written extensively about involving children in health services. In the middle there is a book she edited about participation in health services and really embedding young people's voices. On the left is a co-production project about evaluating the Moorfields Eye Hospital, YPAG. And there's some resources at the end, so you can all get links to these. Peter Beresford is at the University of East Anglia, also part of our ARC, and he's co-edited a series of books which are free to download, which is great, which talk about co-production within COVID, because there's been a number of articles that have said that public involvement actually reduced during COVID. It was difficult to do, people were time pressured, and things like co-production and patient and public involvement got forgotten. We must make sure that we continue to involve people. And Julia Jones, also with us at Hertfordshire, runs the patient and public involvement on the READY trial with a young persons group. And the study is a randomized control trial on physical activity for depression with young people. There's a young persons group, 15 members, and they draw upon different existing groups. So Young Health Watch Bedfordshire, the Youth Council, and a Youth Advisory Board. So I'm just encouraging you to say there are lots of young people groups already out there who may want to feed into the food with care strategy. The Generation R is a symbol in the bottom corner. Again, I'm just highlighting this. Is this the Young People's Advisory Group, whose main remit is again about supporting delivery of paediatric research in the UK. So next slide, please. This is a slide from one of our projects, which took place in a locality within Stevenage. The Stevenage strategy actually said that there were rates of obesity, which Wendy has alluded to. But when we were talking to the play centre staff in this particular areas of Stevenage, so it's very much on a very local place-based location, the play groups are provided for free for children from 5 to 14. The play staff really know the children well and have been working with them throughout, knowing grandchildren and the children that came before those. They are really connected to the community, and they told us that actually it was malnutrition in these particular wards that they served. We went in and we were running some engagement events, just very open conversations about food. The children loved playing with the Play-Doh, supported by an art psychotherapist. They told us about their favorite meals, what they ate, what they didn't eat the day before, but we avoided asking any direct questions. And again, lots of conversations about what's this, good food and not good food, but just to get the children just to talk and play and sit alongside. And this can be something that can be adapted for lots of different age groups. And I'm sure there's lots of play specialists on this call who are far better to talk about that sort of thing, but just showing you the different activities that we've been doing, going out into the communities rather than asking people to come into the university. Unfortunately, COVID hit and we had to adapt our methodology, and the play centre staff were handing out play packs in the park. So next slide, please. So the impact, how to convince those who are sceptical about co-production. There is a growing evidence base that individual studies show co-production with young people to be beneficial, and there are some really nice papers coming out written about this. But one sort of thing I'd like to flag up is we do need some more documentation of involvement. We do need more written evidence. And at the moment, there's very little systematic recording of co-production. And sometimes it's very difficult to, when co-production is very intertwined, what was the young person's input and what was the researchers, what was the clinicians, and sometimes difficult to compare if we're not doing a service without input from people. But please, you've got a fantastic example here of evaluation, and I see people talking about research. It would be so lovely to include this, the hospital, as a growing evidence base of what works, what doesn't work, and points of reflections to change things as you go along. An impact on who? Is it on the young person, the clinician, the researcher, or the community? And we also talk about improving involvement rather than always proving, but I think we need both. On to the next slide, please. The next slide coming up. So feedback, that's why I was really pleased to hear that, because this is one of my bugbears, or the things that I've been trying to champion. We involve people a lot, but they often don't hear if their comments were received, if they were used, if they were useful, and what difference they made. So we have co-designed, in the loose sense of the word, a feedback guidance for researchers about who should give feedback, when to give feedback, what sort of feedback. And I'd really like that to be part again of the food with care strategy. On to the next slide, please. So some top tips from young people themselves. There are 17 tips. This is again from NIHR guidance that probably some people are aware of, but I just thought it was nice to highlight these three about not making assumptions about what we're interested in. Oh, don't ask the young people, they won't want to talk about that. Just ask them, they'll tell you what they do or don't want to be. Use realistic language and understandable language, and find ways to ensure we all contribute as much as we want to, whatever our age, needs, or ability. And that's really about trying to be inclusive. And lastly, my last slide. So lastly, children and a seat at the table. And it's been really nice actually that a number of the presentations have talked about the table as a place of dining. Sometimes it's a table for asking people to give their ideas about involvement. And I want to quickly tell you a story about when I went to join a meeting when my daughter was about 1, she's now 17, as part of the maternity liaison committee. That title nearly put me off. I arrived at the venue, peered into the room. There was a huge table, no room for a pushchair. I knew I wouldn't be able to push my chair back if I needed to breastfeed. And I pushed my daughter around and around, trying to get her to go to sleep. But as you know, children won't go to sleep when you want them to. So I had to go home. They wondered why no one came to the meeting. The second meeting I went to in a different setting was a location with bean bags, with an open door to pop into the corridor if you needed to. There was a huge turnout, and that's not a surprise. So when we talk about a seat at the table, which is often talked about, it might not be a table, it might be the floor, it might be a park, it might be a walk, it might be a soft play centre, a community space, and it might mean lots of outreach work. So my last concluding points are who decides what young people are involved in, who makes the decisions, and really a strong push for children in governance. Need to start early, which you are doing. Inclusion, think about who's not at the table. Are you including individuals, groups, or the community? Flexibility and be reflective. Adapting online, but do remember that lots of people can't go online. People trying to join on a phone is really difficult. I've tried to join meetings on phone. It uses data, it costs money, and it's not the same for adults. The co-production for adults is very different for children and young people, lots of other things to consider. So on to the next slide, which is just the resources, which will be far too small for you, but will be available afterward. And my last slide, just saying thank you very much. And my 2 photographs illustrate, let the children lead the way and trying to see through their eyes.